I don't think no one's here. No one here was too much stuff. Funny.
Miss Taylor?
I understand I had an echo. I understand I had a reaction. I understand my labs. I just want to see my labs and trying to figure out why my chest is hurting. So that's a waste of my breath to say what?
You're with palliative care right now. What exactly are you managing? How are you going to read it? Like,
Yeah.
I'm telling you, it looks normal.
I have a right to see it.
You see it, but
Yeah.
I feel like you're somebody who, if I give you too much information, you are going to be anxious.
No.
Take it too far.
What does that mean?
Based on how many allergies like you have in your list, I'm a little concerned about giving you, like, it seems like it would hurt you in the long term giving you too much information. I feel like you've been evaluated by psychiatry too.
No.
I think there's like some component of anxiety or something going on here.
I do have anxiety because I have a methylation deficiency.
Okay, I believe it.
MTFHR.
Okay, I believe the gene variation.
But that's, do you understand the COMT and MOA and DOA slowly? And that's what induces anxiety. But do I look anxious right now to you?
No.
I'm asking you, I just asked you to show me, to tell me everything's fine. I don't know to trust you.
Okay.
I don't know you. So
I can bring it to you. I just don't know what it will do. But I'm
well,
telling
that
you.
means for you to explain what's going on and trying to figure out the bottom of what's happening. Can you get Miss Davis down here for me, please?
Who's that?
Miss Collins.
I don't know who that is.
Angela Davis Collins,
I do not know who that is.
Director of Advocacy. Can you please get her down here for me?
Please look at this.
I asked you a question.
Please look at the EKG. I don't know who that is. Let me
I
call the charge nurse.
that.
I will go one, but I will do this step by step.
Okay, that's what I just asked you for advocacy.
I will talk to the charge nurse. I'm not
No,
sure this problem.
I just asked you for the Director of Advocacy. Please go get Miss Collins.
Look at the EKG.
I will look at the EKG. I'm asking you to
I'm
please.
not getting out of this room until we finish talking, okay? Like, no. So.
Wait, first of all, check your No, I'm not doing this.
Okay.
You're not going to talk to me like I'm crazy, number one. So the smugness on your face
It's
and
not smugness.
yeah, it is.
I deal with this all the time.
I don't know what you deal with all the time, but you don't deal with me.
Okay.
You don't live with me, and you have not lived my story.
We get a lot of people here who exhibit signs and symptoms like you do. So this is not something
So
that is
do you think people like? I'm not people like. My name is Tracy Elizabeth Taylor, and because I'm not satisfied with, for one, how you came at me with asking me what I do for a living, it doesn't matter what I do for a living. I'm a patient.
No,
So
I'm just curious.
it didn't matter.
Question.
But that does not matter. I'm having chest pain. My blood pressure dropped significantly.
It is not
And that- no,
it is 131/90.
that's now. Did you look at the trend?
Listen, you had a reaction in the MRI machine, right?
I'm not deciding. I just asked you.
We are
period.
watching your blood pressure.
If you then explain why the significant dropped in.
I mean, you were in an MRI machine, right?
Yes.
Those are stressful.
No, honey. I'm sorry. What's your name, doctor?
Don't Mamin.
Say it again.
Mamin.
Namen.
Mamin.
Mamin.
Yeah.
Dr. Mamin.
Mm-hmm.
When I was in there, it wasn't until after I had the dye administered that I felt that.
Sure.
I have VCD. There's a lot of missed information in my record.
Absolutely.
And because of...
Absolutely. That's why we gave you Benadryl. We wanted to give you Benadryl.
No, that's the Benadryl.
That's why we wanted to give you albuterol, which you declined. We
said...
also don't have Zopanex down here.
I cannot take albuterol because it increases tachycardia.
We do
I
not
had
Zopanex here.
I said if you listen and everyone else would listen, if you would have just talked to my speech therapist, Kevin, they know him. He knows my doctor, my ENT, the specialist who knows that I have dysphonia and laryngeal spasms. So I was trying to tell people, but couldn't communicate that. But still, asking me what I do for a living has nothing to do with it. And then you're alluding.
No. It wasn't a judgment. It was just.
You said people like me. You said people like me.
With multiple problems in their problem list, who have an allergy list this long.
No, do you know what? Okay, do you know what Samter syndrome is?
Yes, it is an aspirin-related reaction, I think.
Okay, do you know what happens in Samter syndrome?
No, I don't.
So exactly.
Okay, but Google is a very powerful machine.
I don't care about Google. Dr. Laidlaw called me personally. Go watch her grand rounds.
Okay.
See, now you're making me anxious because it's that mentality. I deferred the Benadryl because you're not giving me a reason why. What was my histamine levels to tell me that I need Benadryl? Number one, I said no to the albuterol because the albuterol I know makes me tacky and it makes me worse.
That's
so,
fine. But we were.
You saying what I refused?
You did refuse. You did refuse.
I refused because it wasn't in line with my care.
No. Listen,
the better judgment for my care.
This is an emergency department.
I understand.
Deal with things emergently. You have.
Do you think I have not had or I have not been in? I was trained with Dr. McSwain, honey.
Okay.
So I said,
that's what I'm asking you. What's your?
It doesn't matter what I did. I have a clear understanding of my disease process.
I don't think you do.
I don't.
Talking about spasming of bones. That bones don't spasm.
What bones did I mention?
The hyoid bone. Apparently.
I said the muscles attached to the hyoid bone.
That's not what I was told. But.
Well, that says again what you was told, but not what you came to see me about.
Okay, that's why I came to talk to you.
You came to judge me.
I came to clarify the situation.
No, you did not come to clarify. If clarify is asking me what happened initially, what brought me to this place, why rapid response was happening, what was my most recent diagnosis. You don't know anything about Samter syndrome. You're not an expert in cardiology.
I'm not.
You're not an expert in genetics.
Listen,
you're not, no. That's your job.
No. My job is to treat emergently.
I know. Yes, I understand it. And that algorithm is not for everyone.
Maybe this was an allergic reaction.
An algorithm is not for every patient.
True. That is for the specialist to deal with. I am doing everything appropriate with my job.
I asked for advocacy. I asked for Miss Angela Renee Collins. Or better yet, call Dr. W.
I work with Dr. W.
Okay, go ahead, call him.
I just walked through.
Okay, go call him.
I'm going to call him at this moment.
Call Collins. I'm asking for my advocacy director. I'm asking.
I will call her as soon as I figure
You saying
out if
when
we need to do anything for your pain, right?
I ask you for my labs. I know.
I want to come
I complain of
the
chest. Well, if you let me see my labs, what is my potassium? What is my phosphate?
3.3.
Can I see my labs? Everything that was done, I need to see. I've been doing this.
I can let you see them, but I feel like this is going to drive the direction of you demanding care. And
I'm not demanding care. I want to go. No, I'm not. Only thing I'm asking is what's wrong with me or what happened. So basically, it's my labs, and you can discharge me, and I got the rest of it.
Okay.
So I need to see my labs. I'm asking to see Miss Collins, and then I'll be discharged.
I'm happy to show you your labs, and I'm happy to discharge you, and you're welcome to see her on your own.
No, I want to see her now, bedside. You cannot deny me that.
I think I'm going to check with my supervisor, okay? Because I feel like this is not. You still want to look at this?
Yeah, and I want my labs, and I want Miss Collins, please. Thank you. That's simple. I'll get house administration if you want to before going up to W.